Let's get into our conversation. And as more people test positive, it is likely that more and more of them will be going into self-isolation. And of course, a lot has been done to cater to their physical treatment. But you also need to think about how they will take care of themselves mentally. Joining me now is Professor Lukoya Atuoli. He is the Associate Professor of Psychiatry at Moore University School of Medicine and Dean Designate at the Aga Khan University Medical College, East Africa. Professor, thank you so much for joining me and for your time. I remember when I was waiting for my results, those 2 days seemed like an eternity. And so many things and thoughts go through your mind. I feel like I was even exhibiting some symptoms while I was waiting for that to come in. And, a lot of people will call this virus anxiety. It's a very real thing. How does one manage this, especially when we're going to be seeing a lot more of this as the numbers surge?
Yeah. Thank you very much for having me on the show. I think one of the things must always be emphasized is that a vast majority of people who will get tested and who will test positive will end up with little or no symptoms at all. And so the vast majority of people will have, mild symptoms or none at all. And therefore, like we saw Jeff saying, he's feeling perfectly all right, except for some loss of the sense of taste. So everybody should know that the majority of them who are tested because of being a contact, some other reason, rather than symptom, that they will be mostly okay. And that should, reduce the anxiety a little bit. And even those that will get severe symptoms, as long as, there is a health facility nearby, there are doctors who can advise them and so on, then chances are whatever symptoms they have will be handled and will be handled well. So that should deal with that anxiety a little bit. But in order to deal with it more comprehensively, when you're waiting for your results, and even if you get positive results and you're asymptomatic like Jeff, it is important to have a routine as you quarantine yourself or as you isolate yourself. It is important to have things to do so that you wake up in the morning and you have things that you're going to do in the course of the day until evening when you should be tired enough to get some sleep. Hearing from Jeff what he was saying, that he wakes up very early in the morning and he has nothing to do. So that can drive up your anxiety. So I think citizens should give him some work to keep doing even while he's at home, like hosting the show as he tried to do today. That keeps him busy, it makes him do his research, and it reduces the time that you spend ruminating on your own fate and ruminating on the symptoms that you have. Secondly, it is useful to remain in touch with your family and friends, even if it is digitally. Have that call, engage people in chats here and there, tell people how you're doing, and those who are close to you should get in touch with you to find out how you're doing. And that contact is extremely important in reducing the anxiety somebody has. Thirdly, it is useful not to focus only on the, on the adverse outcomes. It is useful to think about yourself getting better with time. Visualize yourself recovering and going back to your usual routine and going back home, rather than spending most of your time ruminating on the possible negative outcomes of your illness. And of course, finally, then it is important to listen to the advice you get from your providers, your care providers, your doctors, your health workers, and be in touch with them. If you feel anything strange, if you feel there's a symptom that is emerging, get in touch with them, speak with them, and let them give you the reassurance that this is expected and it will resolve. Or if it needs to be handled, then they would advise you on how to handle it. All in all, don't be defined by your diagnosis. Don't be defined by the fact that you're waiting for a diagnosis. Try as much as possible to continue the rest of your life as safe, in as safe a manner as is possible, without being paralyzed by the fact that you've been tested for COVID-19 or been found to be positive.
Not to be defined by a diagnosis. We know that mental cases rose during this period, and that was because of the restrictions, and that further hampered many mental health patients from seeking and accessing a treatment. And a lot of experts now fear that because of that, we're going to see a lot of people exhibiting what they call layered issues. So it wouldn't just be that one mental illness they were dealing with or mental disorder they were dealing with, but many others compounded on top. How do you feel this can be addressed moving forward?
Yeah, so for people who have pre-existing mental illnesses, they are particularly more vulnerable during this period for a number of reasons. Firstly, just like everybody else, they are vulnerable to the anxiety that comes with the fear that you can get infected and get very sick. So they will be subject to the same fear as everyone else. But secondly, this fear and this risk increases the risk that their existing mental illness will be exacerbated during that time, and they will get symptoms of their existing mental illness as well, or that those symptoms might become more severe than they usually are as a result of the anxiety and the fear during this pandemic period. And then thirdly, there's a problem of accessing care. Many facilities that were receiving people with mental illness either drastically reduced the services they're offering. Some of them closed their doors because they do not have the capacity to test people to determine who should be managed in which place. And therefore, with this scenario, then, if somebody has pre-existing mental illness, then the risk of an exacerbation that will not get adequate care is very high. And that is why we are seeing a lot of people breaking and requiring emergency interventions during this time because they're not able to access their regular care. How this should be handled, I think somebody who has a pre-existing mental illness should maintain contact with their usual care provider. I know many psychiatrists, many mental hospitals, many clinical psychologists have started a system where they can keep in touch digitally with their clients. You can make a phone call or have a video call or have a Zoom call with your provider when you're supposed to go for the clinic and discuss your concerns, discuss the symptoms that are emerging, and the provider should be able to give you advice. And if you need medication, the psychiatrist who's been taking care of you is able to link you with a pharmacy that can deliver this medication to you and you get the care that you need. I know that hospitals like Madari Hospital and Moi Teaching and Referral Hospital and others have set up hotlines where clients can call in and they will be able to speak to a doctor who can provide them with advice on what they need to do during this period. Having said all that, it is also understood that going forward, because of the nature of this pandemic, new cases of mental ill health are going to arise over the next 1 year or so. And this is expected. And therefore, it is our responsibility to plan for it, prepare for it, so that as new cases start coming up, we have the facilities and the resources necessary to provide the care that people need without unnecessarily exacerbating their illness. So this is something that countries have to plan for across the world, and Kenya is no exception.
Prof, you mentioned, different interventions by hospitals and government, such as hotlines and other avenues that mental health patients can use.
It is that offer integrated care that takes care of both physical illness and mental illness for the people. But we also have limited capacity to provide psychosocial support for people going through challenges of day-to-day life. We have challenges in that regard. So COVID-19 has exposed that shortcoming in our country, and it is imperative that we recognize that shortcoming and start making steps to remedy that. Now, fortunately for Kenya, late last year, before we even heard of COVID-19, the president formed a task force, the National Task Force on Mental Health, to provide solutions, because already we were seeing high rates of substance-related problems. We were seeing high rates of depression, anxiety, and suicide. And so this task force was brought together to identify what problems exist in our society that are exacerbating these mental health problems. And fortunately, a couple of weeks ago, this task force handed in the report that had been prepared. I was fortunate to sit on that task force and to contribute to it. And a lot of the things that need to be done in order to handle the mental health crisis during COVID-19 and after COVID-19 are included in that report. Basically, a restructuring and rebuilding of our mental health infrastructure in order to be able to handle the usual challenges in mental health across this country, but also challenges that are going to be thrown up by this pandemic as we go forward. So if that is implemented, I expect that we should see great differences going forward in how we handle mental health in this country.
And that same task force you mentioned, that report was calling for mental health to be declared as a national disaster here in Kenya. So, when you handed over the report to the Ministry of Health, did you see, an urgency, a response on their part to actually deal with this issue and actually agree that it is a national disaster?
Yeah. So one of the things that gives us a lot of hope is that before we even started the work that we were given 80 days to produce a report. Before that, the president had personally expressed interest in seeing the mental health problems in this country resolved. And he indicated that one of his priorities is going to be to ensure that mental health is restructured in order to address the challenges that we are facing, and that the report would be an important component of that. Now, when we finished the work and handed over the report to the cabinet and the principal secretary, we had a meeting with them, and both of them assured us of their complete commitment to ensuring that as many recommendations as possible in this report are implemented. So they gave us their personal commitment. The CS, Mutai Kagwe, gave a personal story of a friend that he was involved in the care of this friend for a very long time, and he had a chronic mental illness and eventually died, partly because of how our system is structured and neglects people with mental ill health. The principal secretary similarly has personal experiences with people with mental ill health, and they indicated that they are very committed to ensuring this. So we are in agreement with government that the mental ill health in this country is a disaster. And the mental health sector requires radical restructuring in order to be able to address this disaster. Some of the recommendations go as far as indicating that we have to have a national body at the level of a commission that monitors our mental health and happiness continuously and produces reports that the president will then report to the people to say, this is the level of our happiness, these are the threats to our mental health, and this is what the government is doing to ensure that these threats to our mental health are handled. We have proposed that Madari Hospital, which has been operating at the level of a district hospital, if you like, with minimal funding, that it be converted into a national referral facility at the same level as Kenyatta National Hospital, as Moi Teaching and Referral Hospital, with a board and a CEO and a budget to ensure it provides the highest level of care for Kenyans and produces research and serves as a teaching facility. We have recommended increased funding for mental health in Kenya, because with more funding, then we can guarantee more training, more research, and better care for the people who require care in this country as far as mental health is concerned. At a personal level, I have looked at the mental health infrastructure in this country, and it is tragic. I have argued that the way we deal with our people who have mental health problems in this country is equivalent to an attempt to try and deny their existence and to eliminate them from our midst. And that is something that, rises to the level of a crime against humanity. These are people who are part of our population. We have to have strategies to take care of the problems they have, just the same way we have strategies to take care of diabetes, hypertension, COVID-19, and so on, for the simple reason that everybody is at risk, and it is just the threshold that somebody can handle that matters. So we think this is an important thing, COVID or no COVID. During COVID and after COVID, we need to implement this report, and in order to address the problems facing mental health in this country.
Prof, you mentioned funding, and I know that has a lot to do with the government saying this is what is important. And for a very long time, not just in Kenya, but Africa, you find the attitude and the thinking, you mentioned this, toward health and disease has been from the medical response aspect or infectious disease aspect. So a lot of what you're calling for and asking for, requires a shift in thinking and attitude. How do we do that in a practical sense? And I know a lot of it has to do with the government putting their money where their mouth is and putting that towards mental health care. But how do you do that in a practical sense in terms of having that mind and attitude shift?
Yeah. So we must start at the top of course, we must start at the top. We must start with, the top leadership of government, the top leadership of the ministries of health, and even in education, social services, acknowledging that whatever they do includes mental health. When you go to the correctional facilities, the leadership of the correctional facilities must appreciate that what they're doing is actually mental health. Because when you take a person with antisocial personality disorder and take them to jail, your goal is to correct their behavior so that they become less harmful to society, and that is mental health. When you go to schools and you're teaching children ways of doing things that you think are fit and adaptive for society, what you're doing is mental health. When you're treating malaria and you make your diagnosis very brilliantly and you make a prescription and the person goes home, if their mental health is not addressed, they're not going to take that medication as they should, and your treatment of malaria is going to fade, as will the treatment for diabetes, hypertension, and other chronic illnesses. In fact, during this pandemic, as long as we do not handle the mental health of the people we are dealing with and acknowledge that people think differently, even as we design our intervention is going to be seen to be suboptimal by the people, and people will disobey some of the things we say. So it has to start at the top, that we acknowledge that mental health is important. We acknowledge that we have to address mental health in everything that we do, and therefore then it will trickle down. And by the time you're doing budgeting, then you're acknowledging that even as you set aside money to buy things and other things, you set aside money for training in mental health, you set aside money for research in mental health, and you set aside money for interventions in mental health that will reduce suicide, that will reduce substance use, and that will potentially reduce violence and even the things that we see on our roads that cause deaths and disability. So it has to start at the top, where we think about everything that we do from a mental health perspective and what impact our policies have on mental health and what impact mental health has on the policies that we already have.
And Professor Atwoli, before I let you go, I'd want to kind of get your outlook and insights on the disease in Kenya in the next few weeks and months. You recently wrote an op-ed in a local daily titled "Lockdown Would Be Pointless at This Point." And of course, this is in light of calls for another lockdown to be put in place after numbers surged. What prompted you to write that, and why do you feel there were some things we may have missed the first time we went into a partial lockdown?
Yeah. Thank you for this. I've been tracking this pandemic since it began, partly as my responsibility when I was the Vice President of Kenya Medical Association. I also chaired the COVID-19 Response Advisory Committee. And we made numerous recommendations about how it was to be handled. So in the beginning, it was important when the cases were just in Nairobi and at the airport and people who had come in by plane, it was important to restrict movement so that you can contain that virus and the infection in one place so that you can then deal with it there and prevent widespread community transmission. What you're calling the initial lockdown was not a lockdown. What we had was a restriction of movement into Nairobi and other parts of the country, but we continued with free movement, practically free movement within those areas. And therefore, the spread within those areas was not constrained in any way. It's only that we limited the spread from Nairobi and the coast to the rest of the country. So when this was lifted, there was huge travel. People traveled to the countryside, people went to the counties and so on. And so community transmission became firmly entrenched across the country. So today, if you're going to do the same movement restriction, it doesn't make sense if you do it exactly the same way we did it the other time, in the sense that you just lock people up and then wait. Ideally, these movement restrictions must be accompanied by other interventions, which include widespread testing in the areas where you have restricted movement, identification of people who are infected and isolation, and also ramping up the preparations in the health facilities by recruiting more health workers, clearing up the supply chain so that people have PPEs, people have the medications they need, people have equipment, including ICU capacity across the country, in this hope that when you reopen the country, you will get a surge in the numbers, but you will be able to handle that surge. But if you just lock people up in their houses for 2 weeks and then you reopen, you have done absolutely nothing. In fact, you have done more harm than good, because then they will come out, there will be more infections, the surge will come, and you will not be able to handle it. But in addition, you will have made people resentful because people are not able to move freely. You will have restricted the economic capacity, and you will not have achieved anything as far as pandemic control is concerned. If the government is not able to put in place measures to handle a surge, and this includes massive recruitment of health workers and massive expansion of our health facilities capacity, then the government should not think of locking up people and just waiting and hoping for the best. That would be a completely dangerous thing to do, and it will be counterproductive, and it is not in the best interest of our public health system.
Professor Atuoli, thank you so much for your time, for your insights, as always. Appreciated. Your final thoughts just before we close.
Yeah. So I think one thing that the Kenyans must acknowledge is that from the beginning of this pandemic, we modeled and said the numbers will start rising and we will have hundreds of cases per day. And if, depending on the success of the control measures, we might even get to a point where we're getting thousands of cases being reported per day until we reach a peak, after which the numbers will start dropping until they come down to, less than 100 per day and so on. So don't be surprised by the increased numbers that are coming. In fact, they're an underestimate because our testing capacity is limited. What we must do is we must continue protecting ourselves. We must continue reducing the risk of infection so that we keep those daily numbers as low as possible in order to ensure that our health facilities are not overwhelmed. If we do that, wash your hands, don't touch your face with contaminated hands, wear masks. Those of us who are going into clinical settings have this face shield and so on. We will reduce the numbers that are being infected on a daily basis, and we will ensure that when you get sick and get severe symptoms, there will be a health facility ready and willing to take care of you. If we do not do that and the numbers surge uncontrollably, there will be no health facility available to take care of you when you get sick, and some people will die unnecessarily who could have been saved if they got to a health facility. So we must continue observing those public health measures, even as the rest of the scientists are looking for a more permanent cure.
Thank you so much. Pertinent issues coming out of this discussion. Thank you, Professor Atuoli. And as we come to a close on JK Live, as is tradition on this show, let's take a look at some of your feedback as we get that up on the screen. Let me take a look at some here. There is one from Danson saying responsibility for compliance with COVID-19 control measures is individual, but the consequences for non-compliance are communal. That's why enforcement is critical. All right, still on Twitter. This one from Gad Isaac. I like the positive vibes from Jeff. Wish him a quick recovery. Thank you for that. Also on Twitter, this one, Njage Kennedy saying, let us all Kenyans take this disease with seriousness it deserves. We must all do our best to protect ourselves and the people around us. That's what makes the difference, indeed. Ndishu saying, facing reality about this virus is getting more scary. I really hope they find a vaccine which is 100% effective. Jeff's smile gives me hope. Fantastic. And that is the last one. Let me read one more here. Calvin Mwashiro from Twitter saying, ever smiling and walking the talk, the COVID-19 is not a death sentence. What an amazing man. My thoughts and prayers are with you, Jeff. Thank you for watching. I'm Victoria Rubadiri, sitting in for Jeff Koinange, our sign language interpreter. Tonight has been Wilson Mushara. Have a lovely night and enjoy the rest of your viewing.